If you're over 60, I'm urging you, please listen to this carefully. I'm begging you to stop a habit so many men do in the bathroom every day, because it could be quietly destroying your prostate. I'm Dr. Cole, a prostate specialist with over 30 years of experience helping older men. And I need to be honest with you. This is something most doctors don't warn you about clearly, even though they see the consequences every single day in their clinics. I've watched thousands of older men who thought they were just taking care of business, normally, never realizing they were slowly causing swelling, blockages, and damaging their prostate bit by bit every single day. Taking longer to pee, a weak stream, having to strain or push, or waking up multiple times at night to go. A lot of men think that's just normal aging, but the truth is worse. Sometimes it's these everyday habits no one ever properly explained, that are quietly making things worse, setting you up for medications, medical procedures, or even surgery down the line. In this video, I won't sugarcoat anything. I'm going to lay out the most common habits that are harming your prostate, and that almost no one warns you about. And make sure you stay until the very end, because the final habit I'll share is the most dangerous one. Something hardly anyone realizes, but it can be the difference between staying healthy or living in pain as you age. First, let me know in the comments where you're watching from. Alright, let's start with one habit almost no one talks about, but nearly every man over 60 is guilty of. First bad habit: peeing too fast, too hard. I still vividly remember a patient named Frank, 68 years old. He came to see me with tired eyes. Embarrassed, yes, but more than anything, desperate. He leaned in and almost whispered, "Doc, I can't control it anymore. I have to catheterize myself at home." Do you know what that means? Every day he had to insert a catheter into his urethra just to empty his bladder because it no longer had enough strength to do it on its own. It wasn't just painful, it was humiliating and haunting for a man who once prided himself on his strength and masculinity. When I dug deeper into his bathroom habits, Frank admitted, "I always peed really fast. I hated standing there too long." And that was the habit that was destroying his prostate, and he didn't even know it. I've seen too many patients like Frank who would finish urinating in 20 seconds or less, sometimes even faster. Think of your bladder like a stretchy pouch holding urine. When you force it too quickly, squeeze too hard, and stop abruptly, you don't actually empty it fully. Some urine stays behind. And here's the problem: leftover urine isn't just water. It's a solution with bacteria, salts, and mild acids. When it's trapped, it becomes the perfect breeding ground for bacteria, irritating the bladder lining, making it contract more, even when you don't want it to. What happens then? You start waking up to pee multiple times a night. It's not just annoying. Waking up 3 to 4 times a night ruins your sleep. Research shows chronic sleep loss lowers testosterone, increases stress hormones, and damages heart health. But there's more. The bladder and prostate sit right next to each other. When residual urine makes the bladder work harder, it increases pressure on the prostate. The prostate, already prone to inflammation in older men, starts to swell slightly, developing chronic low-grade inflammation. You'll notice burning when you pee, weak flow, and stopping and starting. And just like that, the vicious cycle begins. You might think, oh well, it's just old age. But it's not inevitable. This is a habit, and habits can change. I tell my patients a very simple rule. Pee as slowly as you would sip tea. Sit down if you can. Relax. Breathe evenly. Don't push too hard. Don't stop abruptly. When the flow slows down, be patient. Wait a moment to see if there's more. Think of it like rinsing a cup. You don't just splash water and walk away. You let the water flow and clean it thoroughly. I once had a 72-year-old patient come back and say, "Doc, I slept 6 hours straight without getting up to pee. I can't remember the last time that happened." And all he changed was this: peeing slowly without rushing. If you don't believe me, try it tonight. Just go slow. Stand there an extra 20 seconds. Give your bladder a chance to fully contract. Sometimes prostate health doesn't need expensive pills. It just needs patience and understanding. Next up, I'll reveal another common mistake most men never think about until it starts destroying their pelvic floor, prostate health, and bladder control. Second bad habit, straining too hard when you have a bowel movement. If you're the kind of guy who sits on the toilet scrolling Facebook, reading the news, or playing games, stop right now. Let me tell you something that breaks my heart every time I see it in my exam room. Older men often think pushing hard when they poop is normal. They believe the harder I strain, the faster and cleaner it is, or they're just fighting chronic constipation. But your body is not designed to be some high-pressure pump. It's complex, sensitive, especially your pelvic floor, the hidden foundation you never think about until it fails you. Picture your pelvic floor like a hammock, holding everything in place: your bladder, prostate, rectum, and sexual organs. When you strain hard, especially if you're constipated, the pressure in your abdomen skyrockets. That force comes crashing down on that hammock like a heavy weight. Over the years, what happens? The hammock stretches, weakens, develops tiny tears, and gets chronically inflamed. The result? Rectal prolapse, where part of your rectum actually pushes out of your anus. It sounds awful because it is. I've seen patients who needed surgery just because of a lifetime of pushing too hard. And that's not all. That pressure also presses on the prostate, triggering low-grade chronic inflammation, making it swell, worsening symptoms like weak stream, stopping and starting, and nighttime trips to the bathroom. Think it only affects your bathroom habits? Wrong. Your pelvic floor is crucial for maintaining an erection. A weak pelvic floor means blood can't be pumped in or trapped properly to stay firm. Chronic straining injures those muscles, the same way lifting weights wrong can tear a muscle, but this happens in the most private, sensitive area. I've had so many men come in, sheepishly admitting, "Doc, I'm getting weaker, can't keep it up." And when I ask about their bathroom habits, they look down and mumble, "Yeah, I have to push because I'm constipated." That's not fate, it's a self-inflicted habit that damages your body slowly. Here's a simple fix. Put a small stool under your feet to raise your knees higher than your hips. That mimics a natural squat. In that position, your rectum straightens out and stool passes with minimal effort. If you must push, do it gently, in short pulses, like lifting a light weight carefully, not jerking it. Also, stay hydrated and eat more fiber-rich foods like leafy greens, pumpkin, oats, beans, flax seeds, and chia seeds. And try to establish a regular bathroom time, ideally in the morning after waking up and drinking warm water. That's when your bowels are most responsive. Don't ignore your body's signals. Holding it in doesn't just cause constipation, it can actually disrupt the nerve pathways that coordinate your bowels. You might think this is small advice, but I say it with all the seriousness of a doctor who has performed surgery on too many elderly patients for rectal prolapse, prescribed meds to too many men who lost bladder control, and witnessed too many moments of regret that came too late. And yes, there's an even more common habit that seems harmless, but silently chokes your pelvic floor, inflames your prostate, and robs you of the erectile function you've worked hard to preserve. And I see almost every man does it without realizing it. Third bad habit, sitting too long on the toilet. I once had a patient named James, 69 years old. He came to see me and complained, "Doc, lately I'm peeing in dribbles, getting up several times at night, and there's this dull, burning pain." I asked him, "How long do you usually sit on the toilet?" He laughed sheepishly. "Oh, maybe 20, 30 minutes, just to relax, you know." I looked him straight in the eye and said, "James, that relaxing is killing your prostate." Most men don't realize that the toilet wasn't designed for lounging. It's narrow, hard, and gives zero proper support to your butt or thighs. When you sit too long, your entire body weight presses down on your pelvic floor, the same hammock of muscles that supports your prostate, bladder, rectum, and the blood vessels feeding your sexual organs. What happens when you sit there too long? It compresses the pelvic blood vessels, causes blood to pool, and leads to congestion around the prostate and anus. The result? Low-grade chronic inflammation that makes the prostate swell. Many older men come to me saying, "Doc, I'm suddenly peeing more at night. There's a burning feeling when I go, and I constantly feel like I have to pee." My question is always, do you sit too long on the toilet? And almost all of them admit it. Worse still, That long sitting time can dilate the veins around your anus, leading to internal and external hemorrhoids. I've had elderly patients who needed painful hemorrhoid surgery, all because they scrolled Facebook on the toilet for 30 minutes a day. But let's be even more blunt. Prolonged pressure on your pelvic floor also damages the nerves and blood vessels that supply your penis. Erections aren't magic. They're a finely tuned reflex involving healthy nerves and blood flow. When pelvic blood flow becomes sluggish and inflamed, your ability to fill the erectile chambers drops. You'll notice things become slower, softer, or just fail completely. Many men shrug and say, "Doc, it's just old age." But I'll be honest with you, sure, aging is part of it. But sitting on the toilet for half an hour reading the news is sabotaging your own sexual health. Science is crystal clear. Sitting too long causes blood pooling, prostate inflammation, and less elastic blood vessels in your penis. You want your pipes to stay clear and high pressure? Don't sit crushing them 20, 30 minutes every single day. And it doesn't end there, because the next habit is even more damaging. It quietly destroys your prostate, irritates your bladder, and steals your precious nights of sleep, and you may not even realize you're doing it. I know for many men, especially in your generation, there's this weird pride. Real men stand to pee. I've heard it dozens of times in my exam room. They'll half joke, half boast. "Doc, sit to pee? I'm not that old yet." I understand that pride, but let me be blunt. It's costing you your sleep and your prostate health. Here's the problem. When you stand, especially if you're tired, your pelvic floor, already weaker with age, doesn't contract properly. Bladder pressure drops. Your prostate, which is often slightly enlarged in older men, blocks the flow even more. The result? Residual urine is left in the bladder. At night, when you lie down, that leftover urine touches the bladder walls, sending a signal to your brain, "Wake up and go again." And so you're up at 2:30, 3:30, 5 a.m., over and over. I've had patients admit, exhausted, "Doc, I'm waking up 4 to 5 times a night. I'm wrecked." And it's not just lost sleep. A constantly irritated bladder becomes overactive, contracting unpredictably. You find yourself rushing to pee during the day, sometimes not making it in time. Even worse, that leftover urine is prime real estate for bacteria, leading to urinary tract infections, even prostate infections. Some men experience weak flow, burning, or the constant urge to go, and immediately blame prostate enlargement. Yes, that's a factor, but standing and rushing to pee at night makes it much worse. Sit down to pee at night. When you sit, your pelvic floor relaxes. Bladder pressure improves. Your stream is stronger, empties more completely. If you can, also practice gentle pelvic floor exercises, Kegels during the day, not while peeing. This helps you control things better at night. But don't go just yet, because there's one more exercise many men hear is good for the pelvic floor, but if done wrong or too much, it backfires spectacularly, quietly sabotaging your bladder control and sexual health. Bad habit 4, overdoing the stop-start urine flow exercise. I once had a patient named Richard, 72 years old. He came into my office looking pretty pleased with himself. He said, "Doc, I read online that stopping your pee stream builds pelvic floor strength. I've been serious about it. I do it every day while I'm urinating." I asked if he'd noticed anything strange. He sighed. "Well, lately it's harder to pee. I feel this pressure in my pelvis, and I'm getting up more at night." That's exactly the warning I want to share with you today. Richard meant well. He wanted to stay strong and avoid leaking urine as he aged, but he was doing it wrong, and too much. The stop-start technique is only meant as an occasional test to identify the right pelvic floor muscles. It's never supposed to be your daily workout. Think about what happens if you constantly practice stopping midstream. You're forcing your bladder to interrupt its smooth, natural contraction. Over time, the bladder learns to contract abnormally. The result? Weaker urine flow, incomplete emptying, residual urine is sitting in the bladder. And that leftover urine? It's the perfect breeding ground for bacteria, leading to urinary tract infections or even prostate infections. I've had countless men tell me, "Doc, I feel burning when I pee. I'm going constantly. I'm up all night." When I dig deeper, it turns out they were overdoing that stop-start practice. And it doesn't just affect the bladder. The pelvic floor itself suffers. Over-tightening without learning to relax leads to chronic tension. That can cause pelvic pain, low back discomfort, and even affect the nerves that control erections. Ironically, some men ended up losing bladder control, the exact thing they were trying to prevent. I always tell my patients, Kegel exercises done right are extremely helpful. Done wrong, overdone, they backfire and make everything worse. So, what should you do instead? First, stop making the stop-start during urination your main exercise. Use it only occasionally to feel which muscles you're supposed to engage. Instead, do Kegels when your bladder is empty. Squeeze the pelvic floor muscles, like you're trying to hold in urine. Hold for 3 to 5 seconds, then fully relax. Repeat 10-15 times, once or twice a day. Most important of all, always relax after you squeeze. A healthy pelvic floor isn't just about strength. It's about coordination, learning to contract and release smoothly. Richard looked a bit embarrassed when I explained this, but he nodded. A few weeks later, he came back smiling. "Doc, I did what you said. The pressure is way better and peeing feels normal again." But even if you learn to do Kegels correctly, there's still one more hidden habit many older men don't want to talk about. The truth? It silently compresses the sexual nerves, weakens the pelvic floor, and sabotages your manhood in a way few dare admit. Bad habit 5. Masturbating while sitting on the toilet. Let me tell you about another patient of mine, David, 65 years old. When I asked him about his sexual habits, he looked embarrassed and admitted, "Doc, I don't want my wife to know I still do it, so I sneak it in while I'm on the toilet. It's private and convenient." A lot of older American men treat the bathroom as their ultimate private space. But I have to be honest with you, the toilet is not the place for that. And the reason isn't just hygiene, it's about serious biology. When you sit on the toilet for a long time, especially hunched over, leaning forward, straining your belly, you're putting all your weight and pressure onto your pelvic floor. This posture compresses the blood vessels and the pudendal nerve, the main nerve responsible for sensation and erections. During arousal, blood vessels need to dilate so blood can rush into the penis. But sitting like that clamps down on your pelvic circulation, making it harder for blood to flow freely. It doesn't just reduce your erection in the moment, it also contributes to long-term microdamage that can lead to erectile dysfunction down the line. I once asked David, "Do you ever feel numbness or tingling down there?" He nodded, looking sheepish. That's a classic sign of nerve compression. When nerves are repeatedly squeezed, your arousal reflex slows down, sensitivity fades, and worse, erections become harder to maintain. Beyond that, sitting on the toilet for long periods also increases pressure on your prostate. This gland is already prone to inflammation and congestion as men age. Add in the abdominal straining during relief, and you're setting yourself up for irritation, chronic low-grade inflammation, and worsening symptoms like nighttime urination or difficulty starting your stream. This isn't a trivial issue. Plenty of men think it's just 10 or 15 minutes a day, but doing that every day, week after week, year after year, that cumulative strain changes how your pelvic floor and nerves function. Masturbation can be good for your health and prostate, but choose a different location. Use your bed or a comfortable chair where you can lie back or sit upright with relaxed legs. Avoid straining your abs and keep your breathing steady and relaxed. If you need privacy, close the bedroom or bathroom door, but get off the toilet. Give me just one last minute to tell you something I truly believe from the bottom of my heart. You have not lost your worth. It is not too late. I know some of you listening to this might feel both sad and angry right now. Sad, realizing how many years you've neglected your own health. Angry that no one ever told you these simple things. All those tiny habits in the bathroom, rushing your pee, straining hard, sitting too long, holding it in, sound harmless, but they're actually the slowest, most silent ways of wearing down your health. They steal your sleep by waking you up all night to pee. They make you wince with pain every time you strain. They make you hesitant to be intimate with your partner because you're afraid you can't trust your own body anymore. But you know what moves me most after over 30 years as a doctor? It's not medical technology. It's not expensive prescriptions. It's the small but steady changes that brave men choose to make. I've seen men tell me, "Doc, I'm too old to change." And then a few months later, they come back with brighter eyes and a heartier laugh. "Thank you. I'm sleeping better. I'm less anxious. I'm more confident with my wife." I'm saying this because I believe you deserve that too. Don't let anyone, including yourself, tell you that being 60, 70, or 80 means you're done. Aging is not a sentence. It's a privilege. It's a stage where you get to slow down, know yourself better, and enjoy more, if you're willing to pay attention to your body. You don't have to change everything in one day. Just start with one habit. Slow down when you urinate. Sit if you need to. Don't strain too hard. Don't hold it in too long. Listen to your body like an old friend and respond with patience and respect. Imagine sleeping through the night without being yanked awake 3 to 4 times by an aching bladder. Imagine the lightness of not worrying about leaking when you laugh or cough. Imagine the smile on your partner's face when you hold her hand and she sees you're still the man she fell in love with all those years ago. That's not some empty fantasy. That's something I've seen in so many men who were willing to begin again. And if you're still here listening to me, I believe you're one of them. So I'm just asking you for one thing. Tomorrow, pick one habit to change. Just one, but do it seriously, patiently. Because your body has been with you your whole life, and it has not given up on you. Don't give up on it. And if you want to keep going on this journey, if you want me to keep sharing clear, practical, and compassionate medical knowledge about men's health after 60, please hit subscribe and turn on the notification bell. I'm still here. I'm ready to walk this path with you. We have so much more to share, and I hope to see you in the next video, because you have not lost your worth. And I believe you deserve to live a life that is strong, confident, and full of love.